Welcome back to the channel, Roy Ones. I feel amazing. Why? I'm alive, baby, I'm alive. So today I have a fantastic video for y'all. I had a conversation with a Dr. Jonathan Francois, a cardiology fellow at Downstate Medical Center. The topic was about that silent killer, high blood pressure, aka hypertension. This topic is extremely important to me because I have so many family members who have had heart attacks, strokes, and take high blood pressure medication. So I figured this would be an excellent topic to share with y'all. Hello everybody.
Hello.
Thank you for coming here. Tonight is all about your health. And we're blessed to have this space and the people that put it together. The people that put this together are, of course, the Gentleman's Factory and Complete Health Ventures. And today's topic is what? The silent killer, high blood pressure. Now, most people have this that we know. So this information is going to be really fantastic. My name is Lord Thomas. I'm going to be the mediator. And then we have our special guest, Dr. Jonathan.
Good evening.
Wow. So, Mr. Francois, let's get into this and let's go right to basically, how did you get into the medical field? What inspired you to become a doctor?
I think it started around when I was a teenager. What I would say would inspire me probably was not the right reasons would inspire me to get into the medical field, but God, inspires me in special ways. I was watching the show, and it was a show about, physicians, and they were making a lot of money. They had nice cars. I was like, oh, okay, this is a pretty good field. I should get into this. This is really nice. But then, I start building interest into cardiology, into biology in high school. And, in biology courses, you learn a lot about human anatomy. And I was like, okay, I was committed. Okay, I want to be a cardiologist, I want to be a physician, I want to be wealthy. But as I learned more about the field, I really developed a passion for it, right? The pathophysiology, the human anatomy, how the human body works. I really became attracted to that. And then most importantly, the compassion that's required to be in this field, taking care of patients, and the reward that you have by taking care of patients. I feel like I was not, I didn't feel like I would be able to get that level of reward in other fields. So just over time, my passion for medicine just grew as I continued to pursue it in my high school and college.
So what made you get into cardiology specifically?
So cardiology, number one, is the number one cause of death for Black people. So that was one of the main reasons why I wanted to get into cardiology. Second, just how the heart works. It's a very dynamic heart. It's very interesting. And there's many different components of the heart that I was very interested in. For example, the muscle of the heart, how it functions, is very unique. The heart also is dependent on the electricity. So there's an electrical component to the heart, right? The way it beats. And there's also the hemodynamics, how the blood goes through one chamber of the heart to another chamber of the heart. So it's such a dynamic organ that's very unique. Personally, I'm a little bit biased, that's different from other organs, and also very complex. So I was really interested in this complexity and in all the different components of it. And lastly, there's a lot of variety. Like being a cardiologist, you can be many different types of cardiologists. You can be an interventional cardiologist. You could be an electrophysiologist. You're the one who puts in the pacemakers, the ICDs. You can be a heart failure specialist. So there are many different fields within this subspecialty that you can do. And lastly, you're very much in demand when you're a cardiologist. Wherever you go, people need a cardiologist. It's the number one cause of death in America.
Yeah, and related to everything else, right? Stroke, I'm sure, is in the top 5 too.
Yeah.
Top 3. What was it, like 600,000 people a year die from high blood pressure, heart attacks?
Yeah, I would say maybe probably a little bit more than that. I'll say half of the black population has heart disease, has hypertension.
Mm.
It's very common among us, high blood pressure. However, it is also common in other ethnicities as well. Very common among whites too. The prevalence is around the same, but however, black people suffer more severe heart disease or hypertension, and we're more likely to be diagnosed with hypertension earlier in our lives. Right?
So, quick question: why is it called the silent killer? Then is it because, I mean, we know about it.
Mm-hmm.
I mean, for me, it's personal because my father just had a stroke 2 months ago. My uncle just had a stroke 3 weeks ago. So this is very common. So why do they call it the silent killer?
Because many people don't know that they have hypertension until they're diagnosed with a stroke, or they have a heart disease or a heart attack, or they have kidney problems. It's until then these complications develop. Oh, they realize, oh, I've been having high blood pressure for 10, 15 years. For example, just today I had a patient, he's a 41-year-old black male, coming in for chest pain, having a heart attack. When he comes in, his blood pressure is in the 170s. Normal around his age, you want it to be less than 130s. So he's been having high blood pressure for a very long time, probably 5 to 10 years, but was never diagnosed. Has never seen a physician before, has never seen a primary care physician, has been smoking for more than 10 years. And now he's coming in, he's having a heart attack and needs to be transferred to another hospital.
So it seems like one of the major issues is not getting a checkup. And I know for a fact a lot of us don't go to the hospital to get checkups. What is another way, since that seems to be a barrier, what's another way for somebody to monitor and to just check their overall heart health? If they can do it at home, or just something a little bit less intimidated than the hospital.
I will start from, we need to develop the habit of actually seeing a primary care physician. I think it starts from there, or a nurse practitioner, or a physician assistant. I think that'll be the first step. But the best way to really monitor your blood pressure is by having a blood pressure cuff or a blood pressure machine at home, right? And your nurse practitioner or healthcare provider can prescribe that to you. So many times, patients who come to the clinic may have high blood pressure, right? We call that white coat hypertension. Right? They're a little bit nervous. They see the physician, and they've been waiting for 30, 45 minutes, an hour. They're upset. So whenever you measure their blood pressure, it's a little bit high, right? So it's not very accurate. It's not accurate. So many times, what I would do, I would send a blood pressure cuff, an automated blood pressure cuff to my patients, to the pharmacy. They'll pick it up and they'll measure their blood pressure at home. Right? They'll do it on their own. They'll put it on a notebook and they'll put the time. And whenever I see them next time, I'll be able to have a proper, accurate measurement in the average of their blood pressure. That allows me to know if I should start any medications, or if the medications I did give them is working or not, if I need to increase or decrease the dose. Right? So I think that's a very good way to monitor someone's blood pressure.
I have a question for you too when you're talking about medication, because a lot of things that I've heard too is another point where people don't want to necessarily go is because of the medication too. They feel like once they get on the medication, they're on it for the rest of their lives. I've heard several conversations about that. Is there a method or something that people are referring to that will help them wean off the medication once their blood pressure gets stabilized?
So the best thing will be, the best treatment is prevention. So I believe we do need to increase our awareness of hypertension, especially among young black men. We're more likely to have hypertension at an earlier age than any other ethnicity in America. So by increasing the awareness of hypertension, that would probably incline more of us to take certain measures early on before actually being diagnosed with hypertension. So I really want to emphasize on the prevention aspect of it. And the way you prevent from developing hypertension is weight loss. Right? The obesity rate among African Americans is very high. Right? Weight loss, and that can have a huge impact on your blood pressure. In terms your diet, what you're eating. Right? We have a high sodium diet, but other ethnicities too have a high sodium diet too as well. We're not the only ones, but there's some research that shows that we may be a little bit more sensitive to sodium and retain sodium more than other races. So we just need to, adjust accordingly. And there are many reasons behind it. They say it's multifactorial, it's genetic, it's our diet. All those are multiple reasons. Also, our family history. A lot of people in our family have hypertension.
Now, somebody being in your family having hypertension, I see that the correlation is you may have it, but I look at it as a way of you eat the same kind of foods, you're probably in the same environments that cause the stress that actually contribute to you having hypertension like your family. Like you could be in the house meditating and everybody in your family could have hypertension and you may not. Isn't that a possibility?
Yeah, of course. Developing hypertension is multifactorial. It's not only your family history, it's your environment, your diet, many other things, your weight. But of course, if you take your lifestyle, you take it seriously, you probably will not be likely to have hypertension. Your family history is not necessarily end all and be all. It's not because your father and your mother had hypertension that you're going to develop it. There are ways you may have a higher chance or increased chance of developing it, but it does not necessarily mean that you will. And it's important to be aware of our family's medical condition. If your mother has hypertension or diabetes or your father, because then you understand, okay, I may have increased risk of developing diabetes or hypertension. Therefore, I need to take the appropriate measures to prevent that from happening. And this happens on an earlier age when you're 30, 40 years old. You really need to start taking these measures. I know sometimes when we're 30, 40, we think that we're invincible. We eat whatever, we do whatever we want, but you'd be surprised how many patients I see who are 35, 40, 45 coming in for a stroke, for a heart attack. Right.
My nephew was 21 and had a heart attack. So the family was really aware that there's something definitely going on here.
Yeah.
And the good thing is that now he's completely recovered, he's a personal trainer and everything, but it's really a huge issue. And I'm glad that we're talking about it. So since it's a huge issue, what's some of the best ways that we can get this information out to people and not make it such a stigma in terms of just having a physician and getting checked up? And maybe even a problem that a lot of us don't have insurance, because I see a lot of people that are kind of winging it, so to speak, and not having any medical coverage. What would people like that do?
I think community outreach is one aspect that's very important. There's some research that's shown that going actually to barbershops and measuring the blood pressure of black men in barbershops. It's more of a welcoming environment where black men have a habit of being there and they feel comfortable. It's a good place to measure, their blood pressure and also to actually start the conversation if they need any blood pressure medications. So I think community outreach, actually reaching to areas where you could find black men where they're located. Also, the mistrust that we black people have towards the healthcare system, it really has impacted us for generations, right? And it's still to this day. I think mainly the older generation, they have such a deep mistrust towards the system that they refuse to see the physician or refuse to follow any instructions or being compliant with the medications. There's actually research that shows black people who have more trust towards the healthcare system are more likely to be compliant with their medications.
And you're saying men. What about the women? What about the women? What's
The
going
women.
on with the women?
The women too are they more likely to die from heart disease, stroke, than black men.
Also, black men have the strokes and the heart attacks, but they don't necessarily die.
But the mortality rate among black women is higher
Wow.
for heart disease, stroke. Yes, absolutely. There's a lot of research behind that. How women also, the mortality rate for heart attacks, strokes is higher among black women.
Yeah.
And the obesity rate among black women is very high.
Now so how do you reach out to black women then? Because the men go to barbershops and you go to the beauty salon. Is that where you go to try to reach out to black women?
No, black women tend to go to the clinic or tend to follow up with physicians a little bit more than black men. Right? They tend to be more compliant with their medications. I probably will not be the best person to know how to reach out to black women, but I feel it would be the lack of representation of black women among physicians. I think that's key. There aren't many black women or black people in general who are doctors. I think it's also due to the obesity rate. The obesity rate among black women can be very high. And I'm also considering the southeast area, Alabama, Mississippi. This is where you'll have the highest rates of obesity, the highest rates of heart disease, stroke, hypertension. And these are the areas where you have a huge lack of access of care to, which is something that is having a huge impact in the health of black people in general. The lack of access to care, like you said, the lack of insurance. Many of us don't have insurance or appropriate insurance. And I've seen it myself where a patient didn't have appropriate insurance or did not have any insurance at all, and they were rejected by a hospital, and they weren't allowed to get the appropriate test, the test that they needed for us to properly evaluate the patient's condition. The hospital or their insurance, their poor insurance, rejected the test. So it's very disheartening, and you see this quite frequently, and there's not much you can do. There's not much, as an individual, there's not much you can do. The whole healthcare system needs to change.
I agree. We have such a evolution that needs to take place. I think it is taking place, just as we was talking earlier, through the advent of social media and people just being exposed to different things, just like this conversation, being able to hear it and say, well, maybe I need to take some change, because my father never went to the hospital too tough, and my uncle. We both are the same breed, and they both were considered obese as well.
Okay.
Even if it was about 40 pounds overweight. My uncle much more. But now, because they had that experience, it was like a real eye-opener to the point where now they're starting to change their diets and monitor their weight and exercise. The very things that you were saying, that makes the big difference.
Yeah.
So I'm optimistic about the whole process. Is there anything else you want to give in terms of a tip or something that we should be aware of with hypertension, since it's something that we generally run away from? It is very interesting.
I would say family support. I think having your family involved in your own health is key. I think I've seen many patients, I would say the black men who actually come with their wives and having their wife fully involved in their health. I see the best results in these men. Right? They have their wife that's there, that's actually supporting them, pushing them to take their medications.
You better go. You better go.
Yeah. You would ask him questions, he would just give you a brief response, like a one sentence. And she'd be like, honey, no, that's not the story. That's not what happened. You actually did have chest pain that day. Tell them the whole truth.
Because that's how we are. That's how we are. I'm no different. It would be a little difficult, but you have to just be truthful. And I think most men, we haven't been that truthful with our own health. So we can't really express that.
Yeah.
You know, we figure we'll thug it out.
Exactly.
You know, we'll push past it.
There's an ego. There's an ego that is involved. We don't want to show any signs of vulnerability. So when it's time to actually express yourself in front of the physician, how can we help if we don't really know what's going on? How can we help if we don't know if you really have chest pain, or if you have any leg pain, or before you could walk 5 blocks, now you can only walk 2, but you're lying. You say you could walk 5, 6 blocks. It's not true.
Probably said
10. But thankfully, your wife is here and she's telling the whole story properly. So having your wife or any family involved is very important. Actually, men who are married tend to live longer than men who are not married. So I think those may be one of the reasons.
And that statistic need to be spread out a little bit more. I think it would help both sides. Okay, we appreciate your time and explaining and breaking down so much of this stuff, because it is something that needs to be talked about often. It needs to be spread, and I'm glad you're here donating your time to be able to share the message. So definitely appreciate it. There's a couple of points I want to highlight. Whatever foods you put in your mouth, try to make sure they are of high quality. If you can, get grass-fed meats that are organic, wild-caught fish, grains that are organic, because the pesticide, herbicide level is extreme right now, and they are proven to cause disharmony, imbalance within the body. Try to drink fresh, clean water. The best we can do most of the time is some kind of bottled water, Poland Spring or Deer Park. It is better than the tap water. Also, I would like to give a shout out to Complete Health Ventures and the Gentleman's Factory for putting this event together. Hope y'all enjoyed this, and share it so we can help spread the word and help everybody become as healthy as they possibly can.